Okay, so now we're gonna get ready for our clean scrub. I wanna go ahead and make sure I have all my catheter stuff ready. I've got my tape, I have a flush T-port, and I have my flush, my chlorhexidine and alcohol. I've already decided on a 20 gauge catheter for her, so I have two, just to make sure I won't need it. So I'm gonna go ahead and open my catheter up. I don't need this colored plastic part. I'm going to gently wiggle the catheter out, keep that case. I'm gonna spin the lumen here, so I'm just touching the colored part and I'm giving it a spin to make sure it's not stuck on the stylet, and then I'm making sure it's pushed down. And then I'm going to release this back piece so that I can use it. It can take a good amount of wiggling. I'm going to use this once I get my catheter placed, so I'll just put it in lightly, fall out, and then have my catheter resting there. I'll go ahead and ask my restrainer to hold off. Please hold off, restrainer. You can see my vessel here. So I'm going to go ahead and do 3 target scrubs alternating chlorhexidine and alcohol. So I'm going to go right in the center there. So make sure I don't overlap. Just loop it around. One. 2. 3. Just gonna make sure she's not super wet under here. All right. I'm going to put my thumb next to the vessel to try to stabilize it and keep a good grip on her foot. I'm going to go with purpose, try to get through the skin and aim for the vessel, and then I'm going to do my hand switch that you'll see to ensure that I don't contaminate the catheter. And 1, 2, 3, poke. Tough skin. All right, got through the skin. I have blood flow, so I'm in the vessel. I'm going to hand switch now, hold the plastic, and advance the catheter with my other hand without touching it. I'm going to ask my restrainer to put her thumb closer without touching the insertion site, pull my stylet out, and cap my catheter. Keep my thumb on here. Now my restrainer just needs to keep the elbow out, no more holding off. I'm going to tape it in. Holding the leg and supporting my catheter so it doesn't flop around. First piece of tape goes upside down so that we grab a hold of that lumen and secure it.
Sticky side up.
Sticky side up, thank you. Pushing it all the way up to the insertion point. Sometimes takes a little wiggling. There we go. And then I'm just gonna flop this guy over. Every time I pass over my catheter, I want to give it a little pinch to make sure it's actually secure. I'm not going to pull this really tight on her fur. I'm just laying it over, making sure not to cover my entry point there because I need to attach my T-port. So I'm slowly moving backwards. Again, I'm going to pinch. Make sure it's really adhering to her skin and to the catheter. Okay, so there's one piece. I like to put 2 before I put my T-port. My next one goes underneath. Make sure, again, my tape isn't covering the entrance point of my catheter. Angle it back slightly. Still holding the leg the whole time.
Sticky side down.
Thank you. Pressing it down and up and over. Again, moving backwards. I'm not pulling this really tight. I'm just making sure it's nice and snug against her skin. Now at this point, I'm safe to remove the cap and put on my T-port. So again, I'm going to ask my restrainer to go ahead and put a thumb on the tape there. I want to hold the catheter as I pull this out because I don't want to yank my catheter out. Take cap off of my T-port, keep this clean. Got to use a bunch of your fingers here. Secure the catheter, pull the cap out, put the T-port in. Again, I have the leg and the catheter. Now I have what some of us call the bra. I'm doing it sticky side up. I have put a little twist in it so it sits nicely underneath this injection port here. So I'm going sticky side up. I want to go before this elbow. The idea is that I'm pulling the T-port into the catheter so it doesn't slip out. So just before this elbow, I'm going to flop over once, twice, and again press. So now it's pulling, ensuring that T-port doesn't pull out. At this point in time, I'm going to go ahead and flush it before I get too much further. I'm going to flush through the catheter. My restrainer is going to put her thumb over the vessel. I want to do sharp pulses so that she feels it. So, again, securing the catheter as I put this in. A nice sharp, feels it. Good. Now we just need to secure our T-port so it's not dangling. Got my piece of tape right here. I want to make sure I grab a hold of these little wings, and I want to make sure I don't cover the connection between my male adapter and the T-port because I need to attach my fluids here. If I don't grab the wings and I grab just the tubing, this will kink over a lot of times. So I'm going to make sure I just do a little sandwich here on the wings. Place it down where I want it to be. And then it's up to you whether you go over or under your tubing. I'm going to go ahead and go under, but if you did go over, you just want to make sure that you pinch it on the tube so that way it doesn't kink your tubing. But I have plenty of room here to go under. So I'm going to do that. Getting caught up on my friend here. Again, not too tight, pressing it down. And now her catheter is placed and ready to go.
Aw. Good girl.